Investigating clutching interactions for touchless medical imaging systems. Interactive medical imaging systems have been of significant benefit to clinician work. Solutions such as PACS enable all digital workflows. This dramatically reduces the time taken to access and review patient images and makes it easier for clinicians to view patient reports and scans during medical procedures. This has an overall positive impact on clinical work and patient outcomes. Sterility is a major concern when interacting with computer systems in medical settings, especially in areas such as the operating theatre. Touchless user interfaces are compelling because they can reduce the spread of pathogens. This is more important than ever after the COVID-19 pandemic heightened awareness of the risks with shared input devices, especially in hospitals. However, the need for clinicians to maintain sterility has presented interaction challenges when using medical imaging systems with conventional input devices, such as the mouse and keyboard. Currently, to interact with key images in the operating room, clinicians often have to either break a sepsis, rely on colleagues to interact with systems on their behalf, or simply forego interacting with imaging altogether. Such workarounds are inefficient and could impact patient outcomes. Touchless input could transform clinical activity by allowing health professionals direct control of medical imaging systems in a sterile manner, using input modalities such as mid-air gestures or speech commands. However, touchless interfaces have practical issues that limited their adoption. One important usability concern is the Midas touch problem. Unintended input is a key challenge for touchless interaction, and it can be especially disruptive in medical contexts. One method of reducing the likelihood of unintentional input to a sensing system is to employ a clutching mechanism. A clutching mechanism is an interaction that allows users to signal their intention to address the interface. Clutching mechanisms may require purposeful actions that act as a mode switch or show a person's intent, or they may infer intent from a set of constraints and contextual cues. We identified a variety of clutch mechanisms for touchless interaction and performed a direct comparison of 4 such mechanisms: an unlock gesture, a spoken unlock phrase, active zone, and gaze. These were chosen to represent explicit and implicit clutching mechanisms appropriate for medical contexts. An experimental PACS interface was developed. The system combined commonly used PACS features such as image rotation and report access with a list of experiment tasks and touchless user feedback. A training section was included, allowing users to familiarize themselves with touchless interaction, the clutching modalities under investigation, and the interface layout. 34 health professionals participated in the experiment. Interaction performance was measured, and users were interviewed to obtain insight into their views on clutching and touchless control of medical imaging. We used a within-subjects design with 4 conditions corresponding to the clutch techniques. Participants performed a combination of primary on-screen tasks, such as opening a patient record, and secondary off-screen tasks, which simulated a need to lock the system to perform tasks such as interact with a patient. We measured total interaction time for each task, cumulative time the system was unlocked, the number of transitions between clutch states, the total time in each state, and the clutch success ratio. After each block of tasks, participants completed the NACIT TLX survey as a measure of task workload. A semi-structured interview was performed after the final task block. Interviews were transcribed and coded using the framework method. Participants recognized that touchless technology could bring immediate benefit to overcoming barriers to interaction with key imaging in the operating room, giving them direct control and allowing interaction while maintaining asepsis. Participants expressed a strong desire for this level of control, citing how much it could improve their workflow. Comparing the 4 clutching mechanics, revealed strengths and limitations for each interaction type. An analysis of the NASA TLX results shows active zone to be less mentally demanding and frustrating than gesture and gaze, and voice to be less mentally and physically demanding than gestures. Gesture control delivered reliable performance, as well as silent operation. However, it also interrupted manual tasks and could be affected by PPE such as gowns. Further, it had the greatest learning curve of the tested inputs. Voice control felt the most immediately familiar, being similar to delegating commands to colleagues. However, issues with speech recognition can cause frustration, and PPE such as face masks can impact on performance. Gaze delivered high input accuracy, as well as silent operation. However, uncertainty over its behaviour and loss of agency and control frustrated users. Active Zone also delivered high input accuracy, as well as silent operation. It was deemed the least demanding clutching mechanic, working well with PACS usage workflows. However, what is unknown is the challenges of how to deal with multiple users, limited space, different positions in the room, etc. During our study, Ireland's health service was affected by a ransomware attack that brought PACS and other hospital systems offline, severely reducing work rates. Participants had reflected that poor security practices, such as sharing passwords, was common to get around frustrating security policies. They were aware that touchless user interface sensors could potentially identify them using biometric approaches such as facial recognition or voice recognition. Users expressed a desire for clutching to work alongside authentication, enhancing current security practices. Our analysis revealed an appetite for reliable touchless interfaces, a strong desire to reduce shared surface contact, and suggested potential improvements such as combined authentication and touchless control.